A new study confirms that paid sick leave in the U.S. saved a number of lives, but not as many as it could have saved. So this was a peer-reviewed study published in Health Affairs. It is based off the Families First Coronavirus Response Act that was passed back in March. This passed 2 weeks of COVID-19 related emergency sick leave at full pay up to a certain cap, and 12 weeks of paid family leave at 2/3 of daily pay for parents to take care of their children. So this was a study published in Health Affairs. COVID-19 emergency sick leave has helped flatten the curve in the U.S. Now, looking at the number of cases in America, you may think, how much did it really help? But the reality is it could have actually been worse than what the current state of COVID-19 is right now. So let me show you how they did this. From HuffPost here. The new sick leave provision prevented 400 coronavirus cases per day per state in the U.S., according to the paper from researchers at Cornell University and KUF Swiss Economic Institute in Zurich. That roughly translates to 15,000 cases prevented in the United States, or one prevented COVID-19 case for every 1,300 workers. The researchers did not look at mortality rates. A dozen states and Washington, D.C. do have provisions that let workers still get paid if they need to stay home sick. So for the study, Zeyerbarth and his colleagues compared states that never had any paid sick leave law to those that already had something on the books. The idea was to see what happened to case rates after workers obtained a wholly new benefit. It's the kind of natural experiment that scientists covet. They looked at case rates before and after the law went into effect in April. At that time, cases increased in both groups. However, they found that in states where the benefit was wholly new, the increase in COVID-19 cases was flatter. The researchers controlled for the fact that case numbers were increasing during that time overall, as well as testing capacity and population density. Now, this really shouldn't be surprising. If you are not feeling well, and it just so happens that there is a pandemic, and it is incredibly contagious, if you're able to stay home because you're still getting paid while doing so, then you are likely to stay home until you feel better because this law allows you to. So in countries that have paid sick leave, there is a workforce that is just a lot less sick because people actually stay home when they're sick and don't spread whatever virus they have to other people. So of course it's going to also be the case during a pandemic, and you're going to be able to see that difference, or I should say they were able to see that difference when comparing the U.S. to states that had already had the some form of paid sick leave in place, and also comparing the U.S. to other countries as well that already have had paid sick leave in place for years. Bernie Sanders tweeted this out. Now, let me give you some context here. The law, so the Families First Coronavirus Response Act that brought in 2 weeks of emergency sick leave coverage up to a certain cap, that only covered about 20% of the private sector workforce. So this is something that did not apply to employers that have over 500 employees. So this really only applied to small businesses. Meaning, if they had actually instituted this law, this paid sick leave for all workers, you would have seen the numbers drastically reduce compared to what they currently are. So as Bernie tweeted here back in March, share of workers at major corporations without paid sick leave: Sonic 94%, Applebee's 89%, Pizza Hut 88%, Burger King 86%, and it goes on and on. We must make paid sick leave a right for all. So these are all massive companies that clearly, obviously have over 500 employees. They were not forced to institute this paid sick leave. And because of that, you had a lot of people that were sick, going to work, interacting with customers, likely getting other people sick in that process, and of course, spreading the virus because of it. Now, as Common Dreams writes here, the researchers caution that the pending expiration of the benefits at the end of the year increases the risk of rising infection rates heading into 2021. Zeyerbarth hypothesized that the lack of universal paid sick leave policy in the U.S. is one reason why the coronavirus crisis has been so much more devastating in this country than in Europe. Vicky Szabo, a senior fellow at for paid leave policy and strategy at the Better Life Lab, part of the progressive advocacy group in New America, told HuffPost, This study shows why Congress has to act with haste to extend and expand the emergency benefit and why we need a national permanent paid sick days law. Obviously. So this is just, more proof of the benefits of paid sick leave or laws like that. This really, again, is not going to come to a surprise to anyone who just has some common sense. If people can stay home and get paid, they're going to do that. It's going to help in a pandemic, obviously. But it's good to have some research to back this up. And I will link to all of these links below the video. So if you want to read more into it, read how they actually conducted the study and all their data. It's all here. So check it out in the description box below the video on YouTube.